SUNLENCA, in combination with other antiretrovirals, is indicated for the treatment of human immunodeficiency virus type 1 infection in heavily treatment-experienced adults with multi-drug-resistant HIV-1 whose current antiretroviral regimen is failing due to resistance, intolerance, or safety considerations. SUNLENCA is contraindicated for the concomitant administration of SUNLENCA with strong CYP3A inducers. Please see additional important safety information for SUNLENCA later in the video, and full prescribing information for SUNLENCA available at sunlencahcp.com.
Hello, I'm Jacqueline, and I'm here with Jake Jacobs, a healthcare professional with experience in HIV treatment and prevention. We're going to be discussing considerations for before and after care and injection techniques for lenacapavir. Jake, it's great to have you here. Please tell us a bit about your experience in the HIV treatment field and what you'll be explaining in this particular video.
Thanks, Jacqueline. I'm a senior licensed vocational nurse, and I've worked in HIV care for 16 years. In this video, I'm going to show you how to administer lenacapavir injections effectively. Lenacapavir includes both oral pills and injections with 2 initiation options. In option 1, you'll give 2 pills, each 300 milligrams on day 1, along with the 2 injections. Then the following day, 2 additional 300 milligram pills are taken. In option 2, you'll prescribe 2 pills for them to take that day in your clinic and 2 pills to take on day 2 at home. Then 1 pill to be taken on day 8, and then on day 15, you'll give the person 2 injections. The pills can be taken with or without food. Please make sure you explain to your patients the correct dosing and administration of the oral pills. Now we'll look at preparing the injection itself. You'll prepare 2 injections. So that means that 2 vials will be dispensed for 1 patient.
So 1 vial provides 1 injection only.
That's right. Before you begin, make sure that the vial contains a yellow solution with no particles, that the contents are not damaged and the product isn't expired. You may want to check again for particles once the syringe is filled. The next step is to remove the plastic cap from the first vial and clean the stopper with an alcohol swab. Securely hold the needle and the syringe and connect them by twisting in a clockwise direction. Next, remove the needle shield from the withdrawal needle. Pull the plunger back to fill the syringe with approximately 1.5 milliliters of air. Insert the needle into the center of the vial stopper. Push down on the plunger to expel air from the syringe into the vial. Flip the vial upside down and pull back on the plunger to withdraw all its contents. Make sure the prepared syringe contains a yellow solution with no particles. Now carefully remove the withdrawal needle. Remove the injection needle from the packaging. Keep the shield on the injection needle. Next, twist the syringe clockwise onto the injection needle and carefully remove the needle shield. With the syringe pointed upward, expel any air bubbles and prime the syringe to 1.5 milliliters of lenacapavir. Repeat these steps for the second injection. Remember, filled syringes should be administered as soon as possible after preparation. Now the injections are ready to be given to the patient. I find it helpful to have a conversation with my patients about lenacapavir twice yearly dosage, the plus or minus 2-week redosing window, and what to expect during and after the injections. I also advise giving patients some space to ask questions or raise any concerns they may have.
And is there anything you need to be aware of in terms of what the patient may experience during or after the injections?
Yes, absolutely. Firstly, your patient may feel a small prick when you insert the needle and some tenderness afterwards. Secondly, after lenacapavir is injected, the medication collects to form a drug depot beneath the skin. The drug slowly releases over time until the next injection is needed 6 months later. Some people develop a nodule from the drug depot. These nodules are often palpable but not visible. However, not everyone will develop a nodule, so you can reassure patients that if they don't get one, the medication is still working. There are a few different common injection site reactions, such as redness, pain, and swelling. These are some of the reactions a patient could experience, but not all patients had an adverse reaction in the trial.
Are there any techniques to help mitigate pain before giving the injection?
Great question. Yes, there are. These techniques aren't specific to lenacapavir, but are used in clinical care to help make sure the injections are more comfortable for the patient. Using an ice pack before and after the injection has been an effective way to help reduce pain.
Okay, and what about pain analgesics?
To give your patient even more reassurance and comfort, you could consider applying a topical numbing agent at least 30 minutes before the injection on both injection sites. Cover the cream with a non-absorbent dressing afterwards and take it off when you're ready to inject. You'll wipe the cream off with an alcohol swab during your injection site prep. You can also consider giving your patient an oral analgesic before or after injection if there are no contraindications.
That's good to know. Is there anything else you find helpful to put your patients at ease?
Yes, in my experience, I always find engaging patients in relaxed conversation is a good way to help distract them from any injection anxiety. Before you give the first injection, choose an appropriate injection site, making sure it's at least 2 inches from the navel, and then clean with an alcohol swab. Now I'm going to show you how to inject lenacapavir. With one hand, gently pinch a fold of skin where the injection is to be given. With the other hand, completely insert the needle into the pinched skin. If it's possible, injecting at a 90-degree angle is preferred to make sure the injection clearly targets the subcutaneous layer. Due to the viscosity of lenacapavir, the speed of injection may be slow. Make sure the needle is completely injected into the skin and stays in throughout the injection so that lenacapavir is administered deep into the subcutaneous tissue. You can consider using an injection angle between 45 to 90 degrees for patients with a leaner body mass. You can use your clinical judgment to determine the appropriate angle based on the person's body type. Once you've completed the injection, pause for a moment while maintaining a gentle skin pinch before withdrawing the needle to help minimize any lenacapavir from leaking. After removing the needle, carefully activate the needle safety mechanism. Follow the exact same steps to give the second injection, but remember to use a different injection site, at least 2 inches away from the first site. Once you've administered both injections, record the completion in your patient's medical notes. Dispose of the used syringes and needles in a sharps container.
Is there anything you do to help mitigate any pain a patient experiences after you give the injections?
Yes, you can consider putting an ice pack on the injection site afterward to help with post-injection soreness. You can also consider giving your patient an oral analgesic after the injections if there are no contraindications. You might also need to apply a bandage to the injection sites.
And what do you tell your patient once the injections are complete? Is there anything important to mention?
Yes, I take them through any situations where they would need to call me in the days after. And I explain lenacapavir injections should be delivered every 6 months plus or minus 2 weeks. I also recommend booking their next appointment before leaving the clinic or setting a reminder to book their next appointment to allow for timely redosing.
Jake, thank you so much for taking us through that demonstration on how to administer lenacapavir injections effectively. It's been good to see you in action and hear about your own experiences.
You're very welcome. I hope it's been helpful.
Absolutely.
Additional important safety information for SUNLENCA. Warnings and precautions. Immune reconstitution syndrome, including the occurrence of autoimmune disorders with variable time to onset, has been reported in patients treated with combination antiretroviral ARV therapy. Long-acting properties and potential associated risks with SUNLENCA. Residual concentrations of SUNLENCA may remain in the systemic circulation of patients for up to 12 months or longer. SUNLENCA may increase exposure and potential risk of adverse reactions to drugs primarily metabolized by CYP3A initiated within 9 months after last injection. Counsel patients regarding the dosing schedule because non-adherence could lead to loss of virologic response and development of resistance. If virologic failure occurs, switch to an alternative regimen if possible. If discontinuing SUNLENCA, begin alternate suppressive ARV regimen within 28 weeks from last injection. Injection site reactions may occur, and nodules and indurations may be persistent. Improper administration, intradermal injection, has been associated with serious injection site reactions. Adverse reactions. Most common adverse reactions, incidence greater than or equal to 3%, all grades, are injection site reactions, 65%, and nausea, 4%. Drug interactions. Prescribing information. Consult the full prescribing information for SUNLENCA for more information on contraindications, warnings, and potentially significant drug interactions, including clinical comments. Enzymes/transporters. Drugs that are strong or moderate inducers of CYP3A may significantly decrease the concentration of SUNLENCA. Drugs that strongly inhibit CYP3A, PGP, and UGT1A1 together may significantly increase the concentration of SUNLENCA. SUNLENCA may increase the exposure of drugs primarily metabolized by CYP3A when initiated within 9 months after the last injection of SUNLENCA, which may increase the potential risk of adverse reactions. Dosage and administration. Dosage. Initiation with one of 2 options, followed by maintenance injection dosing once every 6 months. Tablets may be taken with or without food. Initiation option 1. Day 1. 927 milligrams by subcutaneous injection and 600 milligrams orally, 2 300 milligram tablets. Day 2. 600 milligrams orally, 2 300 milligram tablets. Initiation option 2. Day 1. 600 milligrams orally, 2 300 milligram tablets. Day 2. 600 milligrams orally, 2 300 milligram tablets. Day 8. 300 milligrams orally, 1 300 milligram tablet. Day 15, 927 milligrams by subcutaneous injection. Maintenance, 927 milligrams by subcutaneous injection every 26 weeks, plus or minus 2 weeks from date of last injection. Planned missed injections. If scheduled injection is to be missed by more than 2 weeks, SUNLENCA tablets may be used for oral bridging for up to 6 months until injections resume. Dosage is 300 milligrams orally, 1 300 milligram tablet, every 7 days. Unplanned missed injections. During the maintenance period, if more than 28 weeks have elapsed since the last injection and tablets have not been taken for oral bridging, restart the initiation dosage regimen from day 1 using option 1 or option 2 if clinically appropriate. Pregnancy and lactation. Pregnancy. There is insufficient human data on the use of SUNLENCA during pregnancy. An antiretroviral pregnancy registry, APR, has been established. Lactation. Individuals with HIV-1 infection should be informed of the potential risks of breastfeeding. Please see full prescribing information for SUNLENCA, available at sunlencahcp.com.